What is obesity? According to the National Institutes of Health, obesity is the second leading cause of death in the United States, with an average of 300,000 deaths per year. But what exactly is obesity? During this speech, I will go over what obesity is and how it occurs, the dangers of being obese, and a few ways to reduce the effects of obesity. First of all, what is obesity? There are many factors which constitute obesity. The Pakistan Armed Forces and Medical Journal in 2020 described obesity as excessive deposits of fat in the adipose tissue due to chronic overnutrition, reduced physical activity, and hereditary reasons. To begin with, chronic overnutrition is also known as overeating, which occurs when an excess amount of food is ingested. Furthermore, reduced physical activity implies a lack of exercise, where the body suffers from a lack of movement and strenuous behavior. Finally, hereditary reasons indicate a correlation of an ancestor who had obesity and their descendant having obesity. In short, obesity is the result of excessive eating, minimal exercise, and inheritance. Secondly, obesity poses many risks to people's health. With an excessive intake of food, most notably fatty foods, blood pressure is increased, making chances of heart attacks higher. Moreover, the weight of body mass and lack of exercise can lead to intense pressure on bones to the point of breaking. Finally, obesity inhibits the immune system, leaving the body vulnerable to other diseases. In fact, Brenda Kakao and her colleagues wrote an article in 2016 claiming, "Obesity is widely recognized as a major contributing factor to the development of several diseases, such as type 2 diabetes, dyslipidemias, and cardiovascular syndromes. These ailments increase the chances of fatality, as well as decrease the odds of successful recovery. In summation, obesity makes the body susceptible to heart attacks, at risk of broken bones, and in danger of contracting other ailments." Lastly, there are treatments available for obesity. One method is surgery, which eliminates a majority of fat all over the body. Another method is increased exercise and mobility, which expends the energy fat contains. Finally, a healthy diet is shown to decrease the amount of weight gained over time. Vikitra Audak and her colleagues wrote an article in 2020 about treating obesity in rats, asserting, "Papaya juice reduced lipid absorption, as well as the anti-obesity, anti-dyslipidemia, and anti-inflammatory effects in obese rats. These findings encourage a diet with fat-absorbing properties, such as papayas, in treating obesity." Overall, surgery, exercise, and a proper diet are viable steps towards curing obesity. In conclusion, I hope all of you learned something about obesity as a whole. Whether it be what it means to be obese, the harm it causes, or the ways to treat it. I am hopeful you will take this topic to heart and are encouraged to take care of yourself. After all, as Francois La Rochefoucauld said, "To eat is necessity, but to eat intelligently is an art." Thank you.